Good afternoon. I'd like to begin today with a simple plea. Please continue to stay home. This will help Illinois flatten the curve, but we all must be willing to do this. You might say, oh, kids planning meetups outside but promising to social distance. We know how quickly that will devolve into someone showing something on their phone, and now you'll have 4 or 5 people encircling around a small phone. We all have to do what's necessary. The beautiful gestures that Governor referred to, dropping food at someone's doorstep, that's great. But the gesture of touching someone else, that's not what we want at this time. We can defer those moves now so that we can enjoy our connections later. To date, we have to report that Illinois has surpassed 10,000 cases of COVID-19. The number is sobering and reminds us that it's critical that we all do our part. The more cases means the more hospitalizations. The more hospitalizations means more deaths. So every gesture or gesture that we forego can help decrease our deaths. We added 1,453 new cases and unfortunately 33 new deaths. We have a total of 243 precious lives lost. We have seen clusters of cases in nursing homes, in assisted living facilities, correctional centers, mental health facilities, and developmental facilities alike. My colleagues and my friends from my sister agencies will be talking about the measures being taken to protect those residents in those facilities. And I want to touch on the difficulty of preventing the virus from infiltrating these congregate settings and the challenges of stopping that spread. The natural movement of people needing to come in and out of those settings, even when they're decreased to the minimum amount, still causes a lot of people moving around and increases the potential for introduction and rapid spread of the virus into people who live, eat, and recreate all in the same space. Options for medical isolation of these COVID-19 cases are limited and vary depending on the type and size of facility, not to mention the residents who are already in isolation for other medical conditions. Ideally, people who are positive should be isolated individually, and close contacts should be quarantined individually. However, that can't always be possible given the constraints of space and rooms. We are focused on helping these facilities and protecting the health and safety of their residents. Public health officials have been going on site to provide guidance on infection control practices, such as donning and doffing PPE, gloves, gowns, and masks. We've also tried to do most of our advice from phone, just to minimize additional exposures. We are working with medical staff and physicians who work in these settings on isolation and quarantine guidance and healthcare triage. Although you may not think so, everyone has a role to play and everyone can help. By staying home, you reduce the amount of virus spreading in the community. That reduces the chance of someone being infected. And that person may then go into a facility and have the unforeseen consequence of infecting a very vulnerable population. So let's all do what we can to prevent that possibility. Stay home, and let's be all in for Illinois and do our part to end this pandemic. And now a brief summary in Spanish. Buenas tardes, me gustaría comenzar hoy con una simple petición. Por favor, si puedes, quédense en casa. Esto ayudará a Illinois a aplanar la curva, pero todos debemos estar dispuestos a hacerlo. Hoy, IDPH informa que el estado ha pasado 10,000 casos de COVID-19 aquí en Illinois. Este número nos hace pensar y nos recuerda que todos debemos hacer nuestra parte. Desde ayer hay 1,453 nuevos casos de COVID-19, incluyendo 33 muertes. Tenemos un total de 10,357 casos y 243 muertes en Illinois. Hemos visto casos en todas partes, en asilos de ancianos, y también en los centros correccionales. Los colegas de mis agencias hermanas hablarán sobre las medidas que están tomando para proteger los residentes. Quiero decir que es difícil para el virus que entra en estos lugares. El movimiento natural de las personas que necesitan entrar y salir de estos lugares aumenta el potencial de introducción y transmisión del virus. Idealmente, las personas positivas deben aislarse individualmente. Sin embargo, esto no es posible de hacer todo el tiempo. Estamos enfocados en ayudar a estos lugares y proteger la salud y la seguridad de sus residentes. Las oficiales de salud pública están ayudando sobre prácticas de control de infecciones. Aunque no lo crean, todos pueden ayudar en estas situaciones. Quédase en casa, reduce la cantidad de virus que se transmita en la comunidad. Por favor, si hacemos nuestra parte poner fin a esta pandemia, todos vamos a salir adelante. And with that, I will turn it over to Director Chapalavia of the Department of Veterans Affairs.